The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk. Welcome to the Birth Baby Podcast. Each week, you'll find guidance, encouragement, and practical tools to support you through pregnancy, birth, and the postpartum journey. I'm your host, Sierra Morgan, a certified birth and postpartum doula, hypnobirthing educator, and pediatric sleep consultant. I'm also the owner of a doula agency in Austin, Texas, and the founder of the Birth Baby Academy, where I offer classes for both parents and birth professionals. Thanks for being here. Hello, everyone. Today I have Amie Volk with me. She is a registered nurse with 6 years of pediatric and newborn experience, and her first job was as a labor and delivery and postpartum nurse. This job really piqued her interest in supporting breastfeeding and chest feeding families, and she has worked at the pediatric clinic for 3 years, where she particularly enjoyed helping new families transition into their role as parents. She works for a local company here in Austin called It's More Than Milk, and we are having her here today to chat with what the heck is the difference between all of the different types of lactation providers? Because I have a lot of parents not know the difference between any of these. So thank you so much for being here with me today.
Yeah, thank you for having me. I'm excited to chat about this and hopefully make it a little bit less confusing for all the families.
Yeah. So there are so many types of lactation professionals. Most people hear IBCLC, and that's kind of like the mecca of lactation consultants. Mm-hmm. But what is the difference between these?
Mm-hmm. So there are quite a few, and it's quite possible that I will not list all of them that exist. But yes, the IBCLC is the one that when you hear lactation consultant, oftentimes that's referring to somebody who is an IBCLC, which is an international board certified lactation consultant. There is also a CLC, which is a certified lactation educator. A certified lactation counselor.
Counselor, that's right. Yeah.
Yeah. And then the CLE is the certified lactation educator. I have seen, because I'm also a nurse and who doesn't like to look at job postings because it's fun. I've seen RN labor and delivery jobs around Austin, wanting the RN to be a CBS, which is a certified breastfeeding specialist. So those are just a couple. There's also a certified lactation specialist, which is CLS. So they're all certified something, but they're all kind of similar in the support they provide, but different as far as the amount of education required to obtain that certification. Do you need clinical experience or just this course that you take? Do you need college level courses? All that kind of stuff. So, yeah.
Does an IBCLC, since that is kind of the hardest one to get, I think, out of all of those, does that one know all of the other stuff? Like, does that IBCLC mean that they can do education and it could be a CLE, basically the CLC, they can do all of those things?
Yeah, that's a really good question. I would say yes. So an IBCLC, so basically, and we can talk in detail about the other ones too, but all of those other ones that I just talked about, they can troubleshoot kind of like more basic breastfeeding problems or common struggles that a breastfeeding parent may experience, and provide support through that. So an IBCLC can provide that support and kind of troubleshoot. And a lot of times that's part of what my appointments are with families is, working through optimal painless latch, that kind of stuff that a lot of, I'm sure you've heard, and a lot of moms have heard friends or families say like, breastfeeding hurts, it's normal. And like the hill that I die. And I'm like, it's not normal. But that is a very common issue that breastfeeding or chest feeding parents encounter. And so, yes, all of those other specialties can kind of help correct a shallow or so latch, but an IBCLC can do that as well, provide that basic support, but also more specific or more difficult things to kind of suss out like what is actually going on.
Because they have a deeper education and deeper knowledge of those potential issues.
Exactly. Yes.
Okay. So, what are some signs that someone may see that they're like, even prenatally, before they even have their baby, that they're like, ooh, I might actually need a lactation consultant before the baby is born? Is that a thing?
Absolutely. Yeah. And I love that you asked that question because being prepared before baby is born, even if you don't have these things that I'm about to mention, can still be so helpful to have that support lined up. But some things that I think if you're experiencing or having these specific things could be helpful to kind of set, even like some lactation or IBCLCs do like a prenatal appointment. So setting up a prenatal appointment and then, booking like a appointment after baby comes. But things like, um, let's say this is not your first child, but your first child, you had low milk supply, or for some reason that you didn't figure out you couldn't breastfeed your baby, whether it was baby wouldn't latch, and I put that in quotations because often there's, some deeper reasons why that's happening. If you had low milk supply, if there was slow weight gain with your previous baby, if you had a breast reduction or breast augmentation, because obviously that is working in the area where your milk is made, it can be helpful to work with someone like an IBCLC. So if you're experiencing milk supply issues, we can kind of troubleshoot is, depending on what kind of incision you had with surgeries, how long ago, all that kind of stuff kind of all can play a role into like milk supply.
Hmm.
If some oral anomalies can be seen on an ultrasound like cleft lip. And so
Mm.
obviously that makes how a baby is going to feed a little bit different, can make latching a little bit different. So that can be very helpful to have support from an IBCLC if you know you're going to have a baby that has that going on.
Yeah, that makes
Um,
sense.
yeah, like if you're inducing lactation, I've worked with a couple of families where they have a surrogate carrying their baby, or their partners carrying the baby, and they were born female and they would like to induce lactation, but they have not been pregnant. That can be something as well to kind of seek support. So there's more things, and I won't go on forever, but there's a lot of
No,
reasons
those are
that,
helpful. Yeah.
yeah, you can see like, hey, this is happening, or I'm encountering this to be a thing. Like, it's totally never an issue to like book a prenatal appointment or just seek. We've had parents reach out so excited. They're like, I'm 8 weeks pregnant, or like, I'm 10 weeks pregnant. Can I? And we're like, I love the enthusiasm. Let's wait
Yeah.
until you're like maybe 25 weeks to schedule something out. But you can absolutely reach out as early as you'd like, even if they're not booking out yet, just to kind of check it off your mental list or whatnot. But yeah,
Yeah.
it's
So
definitely a good idea.
what are some of the things once the baby is born that would be kind of not, I mean, warning signs maybe, but how about flags that maybe you might need support?
Yeah, yeah. So, if your baby is gaining weight slowly, so in the birth and feeding world, we're pretty familiar with it's normal for babies to lose up to 10% of their birth weight, but we want to see them regain that birth weight by the time they are 2 weeks old. So if their weight gain is slow and we're not seeing them hit that back to their birth weight by 2 weeks, or their rate of gain is just slow, even if it's before 2 weeks, if there is weight loss, if you have multiples, if you're being told to supplement by your pediatrician, if your latch is painful, all those things, better to figure them out earlier rather than later, because it
Hmm.
can be harder the longer these things go on to correct it.
How about like
So
a
those,
clicking noise?
yeah, that's a good question. So
I've heard
clicking,
mixed reviews on this. That's why
yeah,
I'm asking you.
yeah. So clicking can, so let me back up and kind of go to like what a baby is doing when they're breastfeeding is they should be cupping your breast with their tongue like a taco and bringing it up to the top of their mouth between their hard and soft palate. And so oftentimes, not all the time, but oftentimes that clicking sound is their tongue like losing contact with your breast. You can sometimes hear it on the bottle too. Sometimes if a mom has a really fast letdown and it's their tongue like moving to protect their airway, it's like that loss of suction. Like, so that's kind of a gray area because if you hear clicking, but your latch is not painful, baby is not acting overwhelmed, like coughing, popping off the breast, sputtering, choking, like weight gain is looking good, I wouldn't say it's something you necessarily need to seek support out unless everything's going well, but you're like, I just want to know what's going on. There's never a problem with just seeking that out, even if things are going well. But
just ruling it out. Yeah.
yeah, like, is this something I need to, is this something that would be helpful for me to know, like if there's something orally going on, like maybe in the future, even if not something is happening right now. But if there's like a painful latch or baby's having trouble gaining weight, and you hear that clicking, then it could be a sign of something is making that tongue losing contact with the breast or bottle, whether that, and we may talk about this in a little bit, but as an IBCLC, like I can't diagnose, so I can't say that your baby has a tongue tie, but I can say like, I'm seeing some restriction in your baby's tongue because of XYZ. And it could be that, or sometimes it could be just like tension, making it hard for baby to just like fully move that tongue in the way that it should. But that's also one thing about being an IBCLC that I really enjoy, is kind of like playing detective a little bit. And like, you have the signs of like, these things are happening, and then figuring out like the why,
the puzzle a little bit.
The why. Exactly.
Yeah.
So that's kind of a bit of a, kind of off your question a little bit, but yes, it's a great area. But yeah, a lot of people do have that question, like, what is this noise? Is it bad? Do I need to do something?
Yeah. So when all of these issues that we talked about, or potential issues that we talked about, are there some times where like a more basic, just CLC or something without all of the IBCLC qualifications can be helpful? And then like, where's that line to where, okay, it's for sure IBCLC territory?
Yeah. So yeah, someone like a CLC, like a certified lactation counselor, they can troubleshoot like more basic breastfeeding or chest feeding problems and provide support and encouragement. And so if you're just like, I would say kind of those red flags that we talked about earlier, like if there is not slow weight gain, or maybe the latch is kind of a little bit painful, but it's not like excruciating. Like I've worked with parents where they're like, it's so painful. Like I can't, I have to pump. Or like if the weight gain is still looking good, but you're just like, is this latch right? Is this position right? Like, and you'll see, which this annoys me, but like on TV shows or movies, it's like people will breastfeed in a way that's like not really how you would actually breastfeed a newborn. And so they're like, well, it doesn't look like that when I breastfeed. Is that right? Like just those kinds of questions. I think it's totally appropriate to seek out care from a CLC. However, yes, if you're like, baby's not gaining good weight, if that latch is really, really painful, if your nipples are like cracked or bleeding, like, and you're like, I can't imagine doing this for 6 months, then I would probably seek out care from an IBCLC. And one thing too that to note is like insurance coverage. It gets a little like muddy between, like, some insurances do cover services from a CLC,
Oh, I
and
didn't
some
know
only
that.
cover from an IBCLC. So oftentimes that's not the first thing that a parent is thinking about, like when they're still pregnant, but just
It's
to
something I
ensure.
think out as a doula all the time. Like usually sometime in their third trimester, on my to-do list for them, for their ideas, is checking with their insurance and seeing if they have a lactation benefit. And if they do, getting a list of who is in network. And then they're allowed, I'm like, you can send me that list and I can tell you who I love off of there if you want to. So because the last thing you want to be doing is when you're sitting there with cracked, bleeding nipples and crying, like to have to look up, not that it's always going to be that bad, but if it is, you don't want to have to be searching your insurance for who's in network.
Yeah. And, like I've had some parents where, and you got to do what you got to do, but it's like they reach out to us kind of like in crisis. Oh, we don't take that insurance. So sorry. Like, yes, we can absolutely do self-pay, but, and sometimes that's completely fine with people, but yes, it is helpful to just kind of like have that figured out before.
Yeah.
So it's just not another thing you have to stress about or take the time to look into.
Yeah, I had no idea that some insurances take cover CLCs.
Yeah, I
That's
didn't
really
know
neat.
either until recently. It definitely requires like a little bit more digging and possibly a pre-authorization depending on your insurance. But I think, like, for example, I think TRICARE does. Is it TRICARE? Yeah.
That would make sense.
Yeah. But they have, I think a lot of those plans have like a limit on the specific outpatient services a CLC can provide. But so nuanced little things that you wouldn't think you need to care about. But it is nice because it does kind of expand access to lactation care for a bit more people.
I think something I've noticed is oftentimes from my clients as a doula, I will see that people maybe have a harder time getting into an IBCLC because it is covered by insurance. So y'all do book out a little bit, further out and are in a bit higher of demand. And so sometimes they're like, okay, I really want to see an IBCLC. It's within my insurance, but I can't get into one for like a week and I need help tomorrow. And so they'll call in a CLC to at least kind of in the interim. So it's almost like a dual help. Like it's my emergency plan if I can't get in. And then if I need, maybe that'll help and great. And if it doesn't, I at least have an appointment with someone else. So with all of these different levels of lactation professionals, and we did talk a little bit about ties, oral restrictions, you said you can't diagnose an oral tie. Can any level of lactation consultant or counselor diagnose that?
No. So the only professional that can diagnose is someone who has a separate license that authorizes them to medically diagnose. So really that's like MD, a dentist,
like a
ENT,
pediatric dentist, ENT.
Yeah, yeah. And oftentimes, well, I guess not oftentimes, sometimes, like, especially if those providers, like if they're primarily working with families and babies and children, like they may have a CLC in addition to MD or an IBCLC in addition to. And so that kind of comes to where, like, if your pediatrician is an IBCLC, yes, they can diagnose that oral tie, but they're diagnosing under their medical license, not IBCLC. So yeah. So
how does that work? If you can tell that someone has one, you just have to choose your words, because a lot of lactation consultants are the ones who are referring to a pediatric dentist to go get a release,
Yeah, it's tricky. Like the language that I will use is like, so this is what I'm seeing your baby's tongue and feeling what your baby's tongue is doing. And these are the big picture signs that we're seeing, like whether it's a painful latch and this is something we haven't talked about yet, but we talked a bit about tension. Sometimes tension can affect how babies are moving their tongue. If that has been addressed and that latch is still really painful, or like an IBCLC, we can do an oral exam and we're like, put on a glove, have them suck on our finger. We're feeling, what is that tongue doing? Are we feeling that tongue dropping? Like we talked earlier about how that tongue is supposed to maintain contact with the breast. Are we feeling that frequent drop? Are we like, sometimes, yes, you may have heard parents be like, well, my pediatrician just looked at my baby and said, this baby has a tongue tie. Because sometimes you can see something very obviously. But my big thing with being an IBCLC is like looking at function, not just anatomically, like physically what you're seeing. But I will basically say, this is what your baby's tongue is doing. This is what we would expect it to do based on these signs and things that we've talked through. It seems like your baby may have an oral restriction, though I can't say for sure. But based on all of these things, I would probably recommend that you go see a pediatric dentist to get an assessment. And yes, like you said, it is kind of just like dancing around a little bit. Even if it's like, even in your head, you're like, that's so obvious, I know, but like, I'm going to be professional. I can't say like that.
As a doula, sometimes I'm like, hey, I can't diagnose this, but I've seen a tongue tie before and it looked like that.
You're like, I know. Yes. I've seen some where it's like very like what a dentist would classify as like a pretty obvious, somewhat severe, like you can, like at the tip of the tongue, that baby can't like really move their tongue far at all, like and sometimes too, when it's like that, they'll be like, the pediatrician in the hospital said he's a tongue tie. I'm like, okay.
Sometimes, what frustrates me is I've had so many people recently have babies with oral ties and tell me that, no, the hospital said that they don't have one. And I'm like, I don't care what they said. That baby can't stick their tongue out at all. I think you should get a second opinion. And if you're listening to this podcast as a listener, I do have a couple of episodes about oral ties with an IBCLC and with a pediatric dentist. So, and I love that you were talking about the co-care of like, or maybe you didn't say that, but that is what it is, of like an SLP sometimes. A speech and language pathologist will sometimes see that, or maybe they need to see a craniosacral therapist if they're having tension in their mouth. Sally, who I just love in Austin, is actually coming to my house right after this recording, and she's doing my whole family for craniosacral. We've never done it before. And I was like, I recommend this to other people all the time. I'm doing it myself. And so, it's not just one thing. It's like, even if it's an IBCLC, you still have your lane. And you still
Yep,
refer out for certain things.
absolutely. Yeah, all
And
the
the
time.
co-care is so important because something that a craniosacral therapist could do could help improve. And then you have the IBCLC come in again. And now we're cooking with gas, you
Mhm.
know?
Exactly. Yeah. And that's like earlier when I was saying addressing tension, a lot of
Mm-hmm.
times we will recommend a parent, um, and there's multiple forms of body work depending on what the parent's comfortable with.
Right.
But yes, craniosacral therapy can definitely help relieve baby's tension, which a lot of times, if that tension is directly what is affecting their latch, and babies, if they're just like your doula, if they've been in the birth canal for 5 hours, like they can't open their mouth very wide because they're just so tight and they look like this, like, oh yeah, that's going to make it hard for them to get a deep latch. Or if they're just like chomping on the mom's breast, she's like, it feels like he's eating me. It's just like, so it's so helpful. Yes, I refer out like probably basically every single visit, whether we're
There's
talking about
something. Yeah.
body work with like craniosacral, or yes, I'm really recommending you get an evaluation from a pediatric dentist, or I think OT would be really helpful in this situation.
Mm-hmm.
Like, I think that's so, so important. And like, yeah, because, I can't do all the things, and this person, that's their lane, and I want you to get the best care. So like, recommending you see this person or that person or whatnot.
Yeah, I think for the parents listening, that was really important for me for them to hear because I think sometimes they'll be disappointed if they think that the IBCLC is just going to fix all the things. Like even the highest
Yeah.
level of lactation consultant is still, you may need something else too. And you can't just do everything if it's not in your lane. So
Yeah.
it's still the resource that is being given because sometimes they'll be like, oh, now I have to do something else.
I
Like they
know.
just wanted
Yeah.
this to be the magic fix and it is a
Yeah.
piece of the
Yeah.
puzzle, but it doesn't
Yeah.
always fix everything.
Yeah, and it's important, like, that's one thing that I really appreciate about working with It's More Than Milk is, like, we are, like, provide that I cannot speak, that
Hey,
comprehensive care, but, and it's like, but also understanding where a person is coming from, like, and I think you can identify with this or relate to this in your work. It's like, okay, this mother just gave birth. She, whether it was like she labored for 36 hours and then ended up having a C-section and then has barely slept, and they're coming in like 8 days postpartum, like just being smart with like how you're like, I'm not going to recommend like two other therapies for a family who they're like huge bags under
so
their
overwhelmed
eyes
already.
yeah, like it's like, okay, like let's just start with some more basic things. Like I'll tell parents like, our goal right now is to feed the baby and protect your milk supply, and so we're going to do that right now, and once we get baby back up to birth weight, or once you're feeling like your nipples 8 year old or whatnot, then we can address some of the other things. But it's like it can be so overwhelming. I mean, yes, those things are so important, like CST or OT or SLP, like, and they have their place, absolutely. But sometimes it'll be like, let's just like wait a week and like just let you like feel like you are alive again. And then like, then
It
kind of
cracks
go
me
from
up
there.
too. All of the letters, right? We're like SLP,
I
CLC,
know.
IBCLC, OT, and
OT,
I'm like, as a parent, as me, I get
what
it.
is
I'm like
that?
in
Yeah,
that
I know.
world, but gosh, as a parent, that has to be
I
so
know. I
overwhelming.
know. Yeah, I have to tell myself like, pediatric physical therapist. Have
Yeah.
you ever worked with that? Like, because also being a nurse, it's like, yeah, all those letters just come to me. And then last thing I'm going to do is overwhelm the family even more.
Yeah.
So,
Well, this is awesome. I really appreciate it. If somebody wanted to learn more about you or the work that you guys do, can you tell them how to find you? And I will also add it in the show notes.
yeah, yeah. So, our practice is pretty active on Instagram. It is very simple. It's more than milk, no comma. My individual Instagram is Amie Volk .lactation. So no space, just my first and last name is one .lactation. Our website, it's morethanmilk.com. You can through there check to see if your insurance covers your visit. You can self-schedule an office visit. It has our like clinic number. You can text us all hours, day or night, like, hey, I'm interested in lactation services. You can call. So there's many ways you can get a hold of us. Whether you're just like, if you're a pumping or breastfeeding parent and like things are going well, but you just want to learn more, like follow us on Instagram. Sunana, our business center, posts like really wonderful, very helpful things on our Instagram
Yeah,
that
I love that.
like, it's just like, I've had people being like, work in the birth will be like, well, I didn't know that. So great information on there. But if you're interested in our services, I would definitely recommend checking out our website, and that'll kind of guide you as far as like what specific thing you're looking for.
Awesome. Thank you so much. I appreciate it.
Yeah, you're so welcome. Thank you for having me.
Thanks for listening. If you enjoyed today's episode, please take a moment to follow, rate, and review the podcast. It helps us reach more families who can benefit from this resource. For more resources, classes, and services, head to empoweredbeginningsatx.com or check out the Birth Baby Academy at birthbabyacademy.com. Until next time, wishing you confidence and calm on your journey through birth and beyond.